So hello everyone, and thanks for tuning in, guys. And yes, guys, it is Monday where I come in and talk a little bit about the mental health piece. So guys, on today I will be talking about different type of personality disorders. And guys, I want to make sure I get this disclaimer out there. I'm not a nurse, I'm not a doctor, I'm not a psychiatrist, I'm not a therapist or any of that. I'm just a young lady that comes on and talk about the mental health piece so that people in our community would know and be aware that there is mental health issues and that mental health is definitely real. And we may even see it exhibited in some of our children, our friends, our co-workers, our bosses, maybe at church. So guys, I just come in and try to give you a little bit of information on those disorders. So today, guys, I'm gonna go ahead and talk about two of those disorders, and I'll be adding some more information in. So the first one I'm going to talk about is severe antisocial personality disorder, which is called APD. Extreme forms of antisocial person disorder may involve persons who repeatedly violate others' rights. And they violate those rights through dishonesty, manipulation, hostility, or even criminal activity. People affected with this disorder are devoid of empathy, regret, and consideration. They occasionally engage in violent and criminal activity, which increases their risk of incarceration. The next one I'll be talking about, guys, is severe borderline personality disorder, which is also called BPD. People who have borderline personality disorder struggle to maintain healthy relationships and are extremely emotionally unstable. In severe circumstances, someone with BPD may self-harm. They endure significant mood fluctuations or have frequent suicide thoughts or attempts. They frequently struggle with emotional regulation, and their impulsive, careless, or violent behavior can have a serious negative effect on their relationship and personal life. So guys, I just want to come in and let you know mental health is real. There are so many different types of mental health diseases out there. So when I come on, I just come on to try to let you know that there are different types and it's so many different ones, and that there are people who are out here dealing with mental health, and some people are not really getting the help that they may need to take care of the situation. So for me, guys, I always use myself as that example. I come on and I talk about the mental health piece. And yes, guys, I do see a therapist because I had a lot of issues when my mom passed. So I went ahead and started going to see a therapist, and it has been a big help to me. I see a therapist once a week, guys. And you do not know how to no one knows how to diagnose themselves. So the best thing is to go ahead, seek help. Go to your primary care physician. You can even go on the internet for Better Health. They have mental health professionals that can help you, guide you, lead you to where you need to be. So guys, I'm just gonna finish up with this about personality disorders. People with personality disorders may struggle to perform well at work, which can result in underachievement, job loss, or challenges obtaining and keeping stable employment. And so people with co-occurring mental issues, which are personality disorders, frequently co-occur with other mental health issues. So they have something else going along with the disorder. They may have, other things going on such as depression, anxiety, or drug or alcoholic abuse. Untreated personality disorders have the potential to worsen these other conditions over time, leading to more severe symptoms and functioning impairment. So guys, just like I tell you, mental health is real. We have people that we may think they're just different or something's not right with them, because those people that we thinking that, you can kind of pick up some things, but when I say that, I mean, you can pick up and say, oh, what's wrong with them? They're different, you know, something's not right or whatever. We got so many people out here in society dealing with mental health. And most of the people that are dealing with mental health are not getting the necessary tools to help them. So guys, do not be afraid. If you even feel you're having some issues, get the help that you need. Mental health is real. And you may not even know that you even have an issue. That's why I always say, make sure you are taking care of yourself. Your mental is most important because it covers everything else under the umbrella. Yes, you need to make sure you're taking care of your physical body. That has a lot to do with it. But your mental controls everything, your thoughts, your inner thoughts, your emotions. So make sure you are going to get the help that you need. Don't be afraid, guys. Don't be ashamed. Because guys, when I figured out I was having an issue, I went ahead and got the help that I needed. And I can encourage someone else, because guys, even after, you know, having my surgery, I just feel like before I had the surgery, God lined me up with everything that I needed. He lined me up with the tools. I had already been talking about mental health. Then I started seeing a therapist. I knew I had been through so much trauma as a young lady in my life. And one day, guys, I'm gonna start talking about that again. I went through so much trauma. I was married twice and I was in abusive relationships, but I felt like I handled all that. But guys, guess what? You don't handle things like you think you do. You just sweep them under the rug. And what happens is when something else triggers it, and you end up pulling everything from up under the rug, or you look up under the rug and see all the dirt that is up under there. So guys, make sure you are taking care of your mental health. That is very, very important. And that is near and dear to my heart. And I'm an example because, like I said, I had the surgery. After the surgery, I have some issues with the side of my body. So guys, that was a lot for me. I'm still dealing with it. I still exercise. I don't stop, can't stop, won't stop, because after the surgery, it changed my whole life. I was able to get back to being me, and it took a little while, but I trust the process. And I'm still trusting this process as to get better and better. And knowing how to handle my mental helps me handle my physical body. And then guys, we have children who have mental issues. We may have children that have mental issues that we don't even understand. Children and adolescents be going through things too. So guys, make sure you're checking on your loved ones. Make sure you're checking on your children. Talk to them about some things, guys. You know, explain to them and let them have a relationship where you can talk to them about what's going on in their life, because they may be going through something that you don't even know about. But guys, I just want to say mental health is real. Take some time out to take care of yourself. Take some time out to love on yourself. You're worthy, guys. And guys, if you like this video, please go ahead and hit that like button and subscribe to the channel if you're not subscribed. And also, guys, hit that notification bell, so each time I load up a video, guys, you'll be there. But guys, I want to say thank you, and don't take your mental health, guys, don't take it lightly. It's very important, especially in these times. So guys, want to make sure you have a great one. And guys, I will definitely see you in the next one. Bye-bye.